My name is Michael Cain. I serve as Vice President for Health Sciences and Dean of the School of Medicine and Biomedical Sciences at the University at Buffalo. My presentation was entitled Prediction of Cardiac Arrhythmic Events with Positron Emission Tomography. And the presentation summarized an NIH-funded clinical trial designed to determine the extent to which denervated myocardium, hibernating myocardium, or the volume of infarcted myocardium best predicted those individuals recovering from a myocardial infarction who are at highest risk for developing sudden cardiac death. The trial results demonstrated that it was the volume of denervated myocardium and not hibernating or the extent of infarcted myocardium that best determined that endpoint. When put into perspective with other risk factors, the volume of denervated myocardium was a better predictor of sudden death than the more traditional risk factors that have been used to determine those patients who receive implantable cardioverter defibrillators, such as left ventricular ejection fraction and other traditional markers. So the impact of the study sets the stage for new trials that use the outcome of this trial and the volume of denervated myocardium as a new risk factor against which decisions can be made to implant defibrillators in patients recovering from infarction who are at risk for sudden cardiac death. I've had the pleasure of attending this conference for the last 10 or 12 years. It is the perfect size to allow dialogues among colleagues and attendees. It also provides a very broad spectrum of topics in cardiology that are discussed. And the other advantage of this is that it truly is an international congress that brings together people from around the world who have the common goal of helping to decrease morbidity and mortality from cardiovascular diseases.
Thank you very much.
You're welcome.